to golf and walk. I'm not a jogger, I'm a Clydesdale. I weigh 230 pounds, so I'm not a big runner. But I enjoy basketball. I enjoy the physical, good physical workout. Only this about 2 years ago, about the bone on bone. I really had a hard time believing it. I was still doing, I think I did the balance after I was told this. And there again, I didn't really have any pain from running or basketball or walking. It was just nighttime pain, and then, like I said, in the last 2 months, it's just gotten worse. Whatever happened, it just gotten worse bone on bone. So he says, you probably need surgery. I was like, well, I just played basketball, so I don't really have any pain when I play, so that's kind of hard to believe. So I went to Dr. Schnellbelt, had an x-ray, and he said, you got bone on bone. And so I tried backing off, and when I did, it actually hurt worse. So the more I do, the better it felt. In the last 2 months, it's just gotten worse. Mainly at night sleeping, I just couldn't sleep. And actually the morning of my surgery, which was Wednesday, I actually played basketball for an hour. I mean, up and down the court, and I went in and had surgery 3 hours later. So again, it was through a consultation with Dr. Schnellbelt. We discussed options, and he said no problems in the past, but he said the front, what's it called, the anterior, there are less restrictions. Obviously, I have no restrictions right now. Versus if you go in post, you can't bend past 90 degrees, and there's just more restrictions. So obviously, with my results, it was a good choice. I've never heard of any horror stories about hip replacement surgery, so I wasn't worried. Plus, I had confidence in Dr. Schnellbelt. Surgical process, I don't have any memory of. Before the surgery, there's just questions and checking everything out, but I don't really have any memory. And as far as since the operation, I just asked what my restrictions were because I wanted to move the leg right away. I wanted to stand up and get up and get moving with it, and I had no restrictions. So I'm looking. As far as moving forward, I want to, just get back to normal life, and especially a normal night's sleep. So far, it's just, again, not the more I do, but once I get up and get walking, the more I walk, it loosens up and it's just easier. I'm trying to push myself and not go over the limit. I'm just a little more aggressive than probably average. I like to be, quicker than, I got back Wednesday night. I want to get one for a walk. Just don't want to lay in bed. I want to get up and go. So finally went for a walk, and I was surprised how good it felt. Looking forward to every day being better and better. This is only the second day. It's Friday. I had it done Wednesday at 11:30, so it's not even 2 full days yet. I'm looking forward. I'm expecting the weekend to be tough because it's after the third day is when everything kind of all the swelling kicks in and all that stuff. So once I get through the weekend, I'm looking at having very, very much success.